You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. Now, the update on the global situation of recorded cases is 282,868. 282,868. That's the global situation presently. Dr. Titus Bayo and also Mr. George Yeboah Kese, MD and lead consultant, Royal Crown Consult, are guests presently assisting us to understand the situation now. And we will get on the phone lines and get to our next other guest that we are bringing on. Yes, actually speaking to him on Skype. And so for very good reasons, we decided that our studio will not, as usual, host 4 guests at a time, because we have to be very serious and intentional about social distancing. So now, before we get to our guest on the line, let me also let you know that this show is brought to you by MTN Everywhere You Go, Bank of Africa, as strong as a group and close as a partner, Amen Scientific, God is the healer, Duraplus, where Duraplus goes, water flows, COAFS, that is your immune booster, Waylead, they build homes for you, and Joy Learning, you just have to keep learning. Keep learning even in this circumstance, particularly at a time when it is expected, as the experts are saying, and they most likely will advise the government and the president that this may be what to do, a shutdown. But our system, is it the way we find elsewhere where they are announcing shutdowns? Are we able to do that? So whilst all of this is going on, I'll invite parents, guardians, that Joy Learning is intensifying teaching lessons in these times as the reported COVID-19 cases in Ghana rise and have compelled the president to announce closure of schools. You can tune your television channel to Joy Learning and access the classroom lessons and other educational programs. You can be assured that with Joy Learning, your children will not be left behind in the classroom teaching while in the house. Do not allow COVID-19 to prevent your child from learning. Joy Learning has you covered. So just tune in. All you need is get a multi-TV digibox for your kids right now. Joy Learning has education in the SS and JHS and the best of teachers who are offering that education. So you have to pay attention. Now, before we go on the phone lines, there are a number of views that have come up. What the president actually did is sort of a state of emergency he has announced, but in different forms and shape. The civil society organization, One Ghana Movement, asked the president, I think yesterday, in a statement, that he should formally declare a state of emergency under Article 31 of the Constitution for the remainder of the president's 4-week shutdown, and take the necessary consequential actions to preserve life and health, including decrowding the business districts of our towns and cities as contemplated under the provisions. Of course, they asked that the president should stop the errant institutions from the registrations and public activities in which citizens are called upon to engage in a public exercise under the superintendence of said institutions. Then they ask that the president should order a closure of Ghana's borders and cancel all flights from foreign countries for the next 30 days, except for returning Ghanaians and essential UN workers or novel COVID-19 medical support missions. Maybe, Mr. Kessie, you can assist us here. Can we do a shutdown as a nation? And if we have to do it, is there not some special way to go about it than what we're seeing? California, 40 million people shut down, stay home, don't go anywhere. We can't do that.
Something, I think in reality, and the call by the body that you just mentioned is also more or less...
That's one Ghana movement.
Yes, yeah. It's more or less a politically correct way of just asking for a shutdown. Because frankly, that is the only way out. No country or no region has been able to go through this epidemic without a shutdown. And the lessons are clear for everybody. It's either we shut down now or we shut down after 3,000 people have died. But the shutdown is inevitable because that's the only way you can control the transmission of the disease. You cannot control it by washing hands. You cannot control it by hygiene. You can only control it by isolation. So it's either we plan towards shutdown now or we plan towards shutdown after our systems have been run down. I feel that all our resources now should be put towards supporting people for a shutdown. And this is where I think government should demonstrate leadership in putting private sector together to support people for a shutdown. We cannot run away from it. We cannot beef up our systems. It's too late. We cannot build more hospitals. We cannot improve our bed capacity. We cannot train more doctors. It's too late. All we can do is prevent the transmission. And that cannot be done with a shutdown, without a shutdown. So I think we should start preparing the minds of the public, and we should start devoting all our resources towards supporting people in a shutdown.
Okay, I'll bring in my next guest, but I would like you to have your take on the issue about a shutdown, because I am looking at where shutdowns have been effected. The systems are there. We don't seem to have the systems. How many days, for example, can we say we have a shutdown and a complete shutdown? Yeah. If we're going to have that, should it be a partial? How is it supposed to be done? I'll come to you shortly, Dr. Bayo, but let's bring our next guest, who is a lecturer, Global Health Department, School of Public Health, KNUST, leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicines. Of course, he has a background in epidemiology and cryptococcidiosis. That's where I am found wanting. Thankfully, the physician who is joining us now holds 2 masters and a PhD in health research and policy. I'm talking about Dr. John Amoisi. Thank you very much for joining us on Newsfile, sir.
Thank you very much.
Right. By your assessment, what do we find ourselves in and what should we be doing? Are we doing that?
Well, I'd like to start by sending greetings to all your listeners who are joining this morning. I think it's really great that we can reach out to them with critical information. I'd also like to thank the panelists who have come before for the really solid information that they have provided to the listeners. I think everything is really spot on, and this is the kind of thing that we should be doing. And I feel like almost everything has been said already. But particularly, one thing that I would like to highlight is our need to to showcase or make more visible what is being done at the national level. I must say that the Ghana Health Service, the Ministry of Health, and others have really put in a lot of effort to make sure that what we can do with what we have is optimized. You heard about the contact tracing that is going on. Unfortunately, not many people know about this and the detail which is going into these kinds of activities. Of course, it's a fine balance between telling people all that you're doing and also restricting information, because information has a way also of inducing fear and panic if it is not managed correctly. But the fact is, as your most recent contributor mentioned, is that we are in perilous times for various reasons, and the reality on the ground is just as the previous speaker made mention of. We are sort of inching slowly towards the probability of a shutdown, and under these circumstances, given the time we have left, perhaps a lot of effort will have to be dedicated towards how we'll be able to live out a shutdown. Of course, we cannot put up emergency structures or significant emergency structures within the next couple of weeks. It will take a little more than that, but we could mobilize a bit better if the trajectory continues, as we are seeing now with 19 cases, we will be inching towards that. But I also want to just touch on a couple of things regarding the approach we are taking to addressing this problem. You've heard about the public health approach, which is your classic disease control approach at various levels, which is really the way things should be. You've heard about the challenges that we are facing and will face when it comes to the clinical care. And this is twofold. One is the health workers themselves, their preparedness, and aside their preparedness, how well equipped they may be with the necessary gear. We have some gear. The question is, will the cases that we will have overwhelm the capacity that we have presently? And you can look as far as the need for more sophisticated interventions like ventilators and so on, which is something that we do not have enough of, obviously, and so that perhaps is not one of the options on our plate. But the area where I want to come in, which has not been mentioned yet, is in the area of research, and that is what I do, and that's what a lot of us academics do. I'm at the School of Public Health here at the KNUST, and also at the KCCR, where I lead my research group in global health and infectious diseases. And you realize that this disease as yet has hardly been characterized in Africa. We've had research and information coming out of China and information coming out of Europe. Even very recently, there have been information published on low-end clinical trials of chloroquine, for example. But there's hardly been any information from Africa. And diseases affect populations in different ways for various reasons. One would be the genetic makeup and other constitutional factors. Others would also be just the geographic location and the lifestyles of the individuals. So it is very important that as we go through this process, we also set up systems that will collect information in a very systematic way so that we learn as we go. And this is the role that we are happy to play as researchers. And I'm very happy to say that the Ghana Health Service has already been very, very collaborative, as some of us have started trying to put up structures and systems in place to be able to start doing research so that the research feeds into the decisions that are taken, so that we can take decisions that really are peculiar to where we find ourselves. Already we know from Italy that this disease is affecting males twice as more than females, or shall I say is killing males twice as much as females in all age groups. Now, this information was not available from China, but we're seeing it from Italy. What new information will come out of Africa? If we do not set up the structures to conduct the research as we move along, we will miss this, and we'll also miss a chance to perhaps put in measures that are peculiar to our situation to address this current crisis.
So, yes, we have heard, for example, Boris Johnson say that we could be out of this in 12 months by way of getting solution. But he says that depends on the collective efforts. How soon do you think, from what you have seen so far, that a solution could emerge?
I'll say that as a researcher, we always say that you can only be certain about how uncertain you are. So anything that is said really falls within a certain range of confidence that could be very wide. And it's almost impossible, especially for where we sit now in Africa, to be able to predict with any amount of accuracy when this will be over, because things could change in a week and that could have implications. So we can only speak to what we see right now. From what we see right now, it is very clear, without any shadow of doubt, that there will be more cases. How many more, we cannot tell, but there will be certainly twice as more. This is guaranteed. But whether it be 3 times, 5 times, 100 times, we just cannot tell. It all depends on the measures that we put in place. Now, getting out of it beyond just the biomedical aspect of it or the virus not affecting so many people is the socioeconomic consequences. And that is something else that we will need to pay attention to. Stimulus packages and other things. Well, that's not specifically my area, but just coming out of it is a whole process. And the country or the world getting back on its feet will certainly take more than 12 months. But as for the disease itself and its transmission, we cannot tell at this stage when it will go away. We've been talking about epidemic curves and all this kind of thing. The truth is the curves act differently in different locations. So the fact that it happened in China, spent about 2 months at the top and started going down, doesn't mean it's going to be the same. Already we can see the number of deaths in Italy has surpassed that of China, even though they have a much lower population. So the curve is acting very differently in Italy. How is that curve going to act in our part of the world? It could be steeper, it could be flatter, we don't know. So what we can do is what we know, which is measures we put in place to prevent transmission.
Do you share the view that our health system is set to be overwhelmed?
What I'll say is our health system has the potential to be overwhelmed. It will be overwhelmed when the number of cases exceeds the capacity of our health system. The rate at which we are going, the number of cases will increase. Right now, as we speak, there are enough beds in various facilities all over the country to take care of cases. But when the cases go beyond a certain point, this will not be possible. We already saw this in China, in Italy, and other parts of the world. The good thing is China was able to put up a 1,000-bed hospital in barely a week.
Right.
All right. Italy has people in the corridors, has people in the reception areas. All right. So I will not say for sure we are guaranteed to have a health system that will be overwhelmed. If you look at the direction in which we are going, there is huge potential for that. But no one with certainty can say that this will happen because we do not know. It doesn't mean we should be complacent,
right? But
we have the potential. And once you have the potential, you put the measures in place to ensure that you don't get there.
Italy has been criticized for perhaps taking things for granted at the start, and that America appears to be falling in the same danger. Do you think that is where we are going?
I wouldn't say that we have taken things for granted. At the high level, you can see the effort that is being put into sensitizing people, putting structures in place. But the question is, to what degree is this filtering down? We're having this discussion right now on a prime radio station, Joy, which goes nationwide, even goes outside the country. The question is, what percentage of our populace is able to tap into the rich information that is being provided right now? Majority of our people engage better in the local dialect, in the different local dialects. Who are the people who are speaking right now in these local dialects, pushing this information across? I liked what one of your panelists said regarding the practicality of self-isolation and quarantine in our part of the world. Certainly there's a way we could be able to do it, but who is going to communicate these to the people down there? So I would say that we need to engage with our socio-anthropologists, social scientists, our behavior change and communication experts, and there are many of these kinds of people in academia here at KNUST and in universities all over the country to begin to, as quickly as possible, design the messages in the local language, design messages that will come across in our transport system, right, so that the information can really filter down. But we're doing everything right so far to the best of our ability, okay, but to what degree is it filtering down? This is the worry.
Doc, what will be your final word to everybody to practically take control of their lives and also the lives of relatives and friends to avoid, COVID-19?
Well, what I'll say is that this disease is not a joke. And as one of your panelists said, it's not cholera, it's not Ebola, and it's not SARS. At least it's not SARS-1. This is actually a type of SARS, but it's SARS-2. And it's one that spreads so fast. And we need to take responsibility as individuals. There's so much that the government can do. There's so much high-level measures that can be put in place. But there is also a role for individuals to play. I received a call from a friend who said he had an uncle who returned from Germany just on Tuesday. This uncle is coughing and sneezing, and this uncle is all over the place. This uncle is educated but will not stay at home. I said, look, call your uncle, tell him to stay at home. And if uncle doesn't want to stay at home, I'll give you some numbers to call so they can haul him in, because it's wrong. And until we begin to be responsible as individuals to recognize that we have a role to play, things will get difficult. So what I'll say is that we're happy about whatever is going on at the national level. We'll encourage and stand behind our health workers and all those putting things in place. We will criticize them and encourage them to do more, but there's much more that every single Ghanaian has to do to stay safe, and also to call out those who are doing things that will make all of us or put all of us in danger.
Thank you very much, Dr. John Amonsi, for your time and for assisting our global audience to appreciate what this is and to speak also to authority and leaders to take the necessary steps. Thank you very much indeed. And if I come back to the studio, I really want us to take a quick break, and then when we return, we can now have all of you, wherever you are listening, to join us by phone call. You can send us messages or you can call into the show and let's have your experience. And if you have any questions for Mr. Kessie and also for Dr. Bayo, we will welcome them. The numbers to call: 0302 211 691, 0302 211 692. So it's 0302 211 691 or 0302 211 692. You can call us right after this break. We'll take your questions directly and then we'll deal with the other matters that we have at hand.